India was an idea I had talking to a colleague of mine who was sick, and we entered a competition, Piramal Foundation, which put out a call for democratising healthcare in India. So we put a tender together, a proposal to bring out family medicine out to India, and we came second to the cataract train. We were the only one of 40 international finalists. We came out, and the interest was so great that we didn't let it go, even though we hadn't won the prize. So over the last 4 years, we've made several trips back and forth to the UK and to India to see whether it's a viable proposition to bring family medicine back to India. India is the most over-medicated population. They see far too many specialists. There's no prevention, and there's a massive burden of communicable and non-communicable disease, and we thought that we could add something to that. So we put money together, we raised money from our friends and family to start this venture, and we opened our first centre in Janakpuri last month in Delhi. We have a plan to roll out up to 145 centres over the next 5 years, and this is all based on a UK model of general practice. We will have a hub which is going to have 4 doctors, 4 nurses and healthcare assistants who are going to do both acute and preventative care, and then attached to those are what we call DIBs, doctor in boxes, and which will actually be eventually nurses in boxes who will serve the community, and there'll be roughly about 10 to every hub. And we are at the moment training nurses to practice nurses as they are in the UK, and then we will train them up to be healthcare up to advanced nurse practitioners who will then run those sites for us. And it's a completely different concept to India that India's ever had before. We want a nation change. We really want to lay the cornerstones for giving India something that will help with its economic boom, actually a healthcare boom. This is the diabetes capital of the world. It's World Diabetes Day today in India, and the media are picking up on that. Families themselves are understanding the risks, their health risks. And what I want to do is to not only start a wave of preventative medicine in India, and help middle classes, the emerging middle class, bring themselves out of poverty. I want to stop them going into poverty by going and getting what they think is good healthcare and being over-investigated and going and seeing a number of super specialists, which then leads them back into poverty because of the bills. I want them to understand how lifestyle changes will prevent them developing heart disease, diabetes, stroke, the things that kill us in the West and that are killing them now in the East. Helping them with stop smoking, helping them about what to cook, how to eat, about exercise, and working with government to put in things that actually help common man help themselves, so that we don't over-medicalise problems and we don't make the same mistakes we've made in the West. If I could say anything to people from the West, nurses from the UK or the US who actually think, is this something, could I go and have an experience? Could I go and just put myself out of comfort zone before I go and get married and have children? I'd say come here and try and make a difference, because your basic caring needs, your basic caring skills that you had that brought you into a profession would benefit the general, common Indian so much. Because if you could only sit on the floor with somebody and hold somebody's hand when they were going through an experience, you would make such a difference to somebody. Don't worry about disease and stuff. Having jabs and getting accommodation and moving around cities and around India is not difficult. It's just, it's scary to say you're going to do something, you're going to change your life, and whether it's for 2 weeks or a longer period of time. But it's incredibly rewarding, and if you just embrace it, you'll have a fantastic experience and something that you'll store in your memory and store in your, that day when you're an old lady or an old man sitting, having gone through your life and thinking of all the rich experiences you've had. You would actually feel like you've made a difference. And I really would say that for everything if I walk out now and don't do another thing, I feel I've touched some people's lives and made a difference.